For the first time since Roe v. Wade was struck down in June of last year, abortion services have started again in the state of Wisconsin.
This change coming as Planned Parenthood of Wisconsin announced that it would resume services in Milwaukee and Madison. Now, the nonprofit says this decision came after two rulings stating that the current 1849 law that seemingly banned abortions is not enforceable and does not ban consensual abortions. Planned Parenthood offers a variety of health services such as birth control, sexual health testing, cancer screenings, hormone replacement therapy, and abortion services. Their Milwaukee clinic tells us their appointment books were completely filled within 24 hours of their announcement on Thursday.
So the question on many people's minds, will other healthcare providers across the state follow the lead of Planned Parenthood?
Ben Jordan talks with an OBGYN who left state to practice following the Dobbs decision about why she thinks hospitals and abortion clinics will wait in order to avoid legal jeopardy.
Two Wisconsin doctors tell me hospital and healthcare systems across the state immediately halted all abortion procedures when Roe v. Wade was struck down, and they don't think that's going to change just because Planned Parenthood is proceeding.
I am thrilled that women in Wisconsin now, as of today, have access in Milwaukee and Madison.
Dr. Kristin Lyerly of Wisconsin is speaking with us from a hotel room in Arizona, where she currently works as a traveling gynecologist.
I want nothing more than to go back to work in Sheboygan. I loved taking care of my patients in Sheboygan.
As someone who used to provide abortions at Sheboygan's Planned Parenthood, Dr. Lyerly says she knows the struggles OBGYNs have faced in Wisconsin the past 16 months.
Many abortions are performed in other hospitals, in other settings. Often these are more medically indicated for high-risk pregnancies, for miscarriages, for other reasons. And these are the people who right now we're most concerned about because they still are living with this uncertainty about whether they will be threatened with this criminal prosecution just for taking care of their patients.
Dr. Lyerly says hospitals and healthcare systems across the state have had to arrange for pregnant patients who are facing complications to get care elsewhere. The 1849 abortion ban, which is currently at the center of two lawsuits, prohibits abortions unless it's deemed necessary by two physicians to save the mother's life.
Well, that's the tricky situation, isn't it? Like, when is a mother's life at risk? I know because I am a doctor who has trained for many, many years and has many years of experience. But would the district attorney, who has no medical experience and is politically motivated, agree that I chose the right time to perform that abortion? It's a gray area.
Since Wisconsin abortions came to a halt in June of 2022, the Associated Press reports about 300 Wisconsin women have gone to Illinois each month for abortion care.
For those people who really are dedicated to helping their patients get what they need, they're on the phone to us.
Meg Larkin is a clinic administrator at Rockford Family Planning. A Madison doctor opened the clinic at the beginning of the year to offer care for Wisconsin women right across the state line.
Good 45% come from Wisconsin.
Dr. Lyerly does not believe other healthcare facilities in Wisconsin will resume abortions like Planned Parenthood until this plays out in the legal system.
To be very clear, I don't think that other healthcare providers in the state will feel comfortable providing any sort of abortion care until we have a final judgment. I am not personally comfortable.
I reached out to all of the major healthcare providers in the Milwaukee area to ask whether they plan to resume abortion care in light of this Planned Parenthood development. The only one I heard back from was Freighter. Its staff tells me they're still analyzing this legal uncertainty. Reporting in Milwaukee, Ben Jordan, TMJ4 News.
Well, there are still several restrictions under the current law. That includes a 24-hour waiting period, 20-week abortion ban, mandatory ultrasound, no telemedicine, and parental consent for minors.